And joining me now is Dr. Emily Sickbert-Bennett, Director of Infection Prevention at UNC Medical Center. Dr. Sickbert-Bennett, thanks for joining us today.
Happy to be here. Thank you.
What is your recommendation to our viewers as it relates to dining out or going to a bar? Is it safe if you're vaccinated?
It certainly is much safer if you've been vaccinated. It's very important to continue to remember what the key risk factors are for COVID transmission. So person, time, place, and space. And the ways we can mitigate those things are by going out with fewer people, spending shorter amounts of time in restaurants and bars, and then considering the spacing that you're in. And if it's beautiful weather and you're able to eat outdoors, that's certainly a safer option as well.
North Carolina has been a little more patient with reopening than other states. What can we learn from those other states who opened weeks ago? Are we seeing any drastic increases in COVID-19 cases?
We are definitely closely tracking the progress in other states where some of the policies have changed at a different time interval than ours. It's obviously, complicated. It's not just about the policy changes, but also about people's behaviors and choices. And so we do continue to watch for increased numbers of cases. And in North Carolina, we're seeing some plateauing. So we're definitely keeping our eye on how we can continue to drive infections even lower.
What do you think is causing some of that plateauing?
Well, certainly over the holidays, what we experienced, no different than other states, was some reopening in the fall, I think followed by a lot of social gatherings that are really the hallmark of our holiday season. And what we've learned from a lot of the outbreaks and clusters is that most of these transmission is happening from social gatherings. It's not necessarily incidental communication transmission out in public as much as it is our choices and who we get together with and whether we're wearing masks when we get together.
What's going to be required of us to get those numbers back on a downward trend? Will the vaccine naturally take care of it?
We certainly are very excited about having the vaccine open to more populations. We have a tremendous amount of work to do to get it to all the populations and make sure that it's really provided in an equitable fashion and that we overcome some of the hesitancy that has come with a new vaccine and convincing others to get it. And then, of course, we're certainly watching what's happening as we learn more about the variants, whether the vaccine will be as effective for some of these variants. Luckily, we know how effective masks are. We know that when we have a comfortable mask that fits our face well, that will protect us for any vaccine breakthrough transmission or for any variants that aren't covered by the vaccine as well. So a combination of vaccine uptake and mask compliance is really going to be key.
Speaking of masks, the governor also announced last week the state mask mandate will remain in place. Some states have removed that mandate. What impact is the mask mandate having on North Carolina's COVID-19 trends?
I really think that the mask mandates that we've had in place have really been responsible for keeping it as under control as it has been in North Carolina. In the hospital setting, we weren't seeing the overwhelming surge, the crushing surge that some other states were seeing. And we're really grateful for keeping the disease at bay with the mask mandates. We know that masks are so effective because they protect you from others when others are sick. They protect others when you are sick, and they cover your nose and mouth, which is the way you could incidentally, with hand contamination, introduce COVID infection into your body. So they really provide three important functions, and I think it's really going to be the key intervention for us to continue so that we can really drive these numbers back down to very low levels again.
Doctor, thank you for your time and appreciate you joining us this morning.
Thank you. It was a pleasure.